I would just kindly ask you to introduce yourselves and to tell us where you're coming from.
Right, well, I'm Ian Castles and I'm from Wellington, New Zealand, and my partner is...
I'm Caitlin and I'm also from Wellington, New Zealand.
All right, why are you here in Swiss Medica? What brought you here?
I have a disease which has really only got one obvious, well-known conclusion, which is lung transplant. So this is an alternative to that and may work, so I'm very keen to try it.
So how did you come up with the idea of trying stem cell therapy? Who told you about it? How did you find out information about our clinic? Have you considered other clinics in the world?
Well, I have had I've had a stem cell treatment in New Zealand before, but it was inferior. It was just my own cells and a low number.
And he has no fat.
And I had no fat, but it was a good result, but not a great result. And these stem cells appear to be more potent, able to do more, so worth a try.
So have you informed your doctor about it?
I've got a lot of doctors, but and not many of them know much about it. But yes, I have. I was recommended by a dermatologist to try it, who's in 𝘗𝘭𝘦𝘢𝘴, and he has a different approach to risk and reward. It's all to do with, this whole proposition is to do with what the reward is and what the risk is. The risk is very low and the reward is huge. So it's definitely worth giving it a go.
Have you tried contact any other clinics apart from ours?
Well, I looked it up on the internet and I was referred to it by this dermatologist doctor in New Zealand who thought it was worth looking at.
This one seems to have the reputation that you want to.
Well, we know they're available in the other places in the world, like Mexico, and this is more appealing. I mean, the Swiss have been, I believe, have been doing it longer.
Okay. Tell me about the process, the preclinic process. Was it too complicated for you? Were the doctors and consultants competent enough to answer all your questions?
I think it's been very good. It's like a nice little family. Very.
Okay, when you found yourselves in Serbia, how did you feel? Did you have any fears before coming? If you had, how you overcame those fears? You're coming all the way from New Zealand. It's a long way from here.
The time zone is what got us. It took us a long time to adjust that way. And I think understanding the city, it takes a while to get your bearings, to understand the people. The people are lovely. They come across as very...
bleak, but then they all laugh, don't they?
But they laugh so easily, yeah.
Bleak and laughing all the same time.
Yes, yeah. But no, we've had a lovely time here, an interesting time. Interesting, yeah.
Ian, a little bit of your treatment. What was included into your treatment plan? What kind of therapies you had here? And a little bit of our medical staff, doctors, nurses. How do you feel?
Oh, they're all highly competent. We had, I had hyperbaric and lung stimulation with the machines. I had endless infusions, which would all have been very useful, inhalations and nasal sprays. I think it was an amazing session. And I wonder if I should have stayed 2 weeks rather than just a week, but I think it's given me a very good chance of seeing how good it is, and I believe it will be good.
Because we only discovered the museum yesterday and it was closed.
It's always closed on Mondays.
So we need another week.
You just get sleep, just inform me, yeah. Have you already started maybe feeling some changes, or if not, it's a long, lasting process to start feeling changes with the stem cells. What are you expecting? Which results are you expecting?
Well, we both had treatment, so I think 2 or 3 months I'll start getting positive test results, which I'll correspond with the clinic about. Yeah.
Maybe you can give some piece of advice to people having the same lung problems. So what kind of advice you'd give to them?
Oh, I just don't think they know. I think it's just a question of the visibility of these stem cell treatments. And I believe it's a evolving and rapidly evolving medicine which will be very useful. So.
Because you only came about it by talking to somebody. It wasn't through research that it necessarily, it was once he started researching, then your name came up. So in New Zealand it was talking to people the visibility maybe needs more.
Just something in the clinic
Stem
in New
cells are
Zealand.
being talked about more and more now, aren't they?
Yeah.
Yeah, stem cell treatment.